Hello, my name is Dr. Dewan S. Raja. Today I will discuss about aqueous humor and the pathogenesis of glaucoma. The aqueous humor is present in the anterior chamber of the eyeball as well as the posterior chamber of the eyeball. Anterior chamber is the area between the iris and the cornea, and posterior chamber is the area behind the iris and in front of the lens and ciliary process. Aqueous humor is present in the anterior chamber and the posterior chamber. It is produced in the rate of 2 to 3 microliters per minute. It is produced actively by the epithelial cells of the ciliary process. This is ciliary process. This is ciliary body. It has some elevation depression, and these are the ciliary processes. Those ciliary processes are lined by the epithelium. That epithelium actively produce aqueous humor. Secretion begins with active transport of sodium ion in the interepithelial space. Then to neutralize the ionic balance, bicarbonate and chloride ion follows the sodium ions. All this ion draws water from the underlying capillaries through osmosis. We have capillary here in the ciliary body. So by osmosis, the fluid will come out from the capillaries, goes to the ciliary process and actively secreted by the epithelial cells. So from this picture we got the anterior chamber, posterior chamber containing aqueous humor. Our posterior compartment of the eye contains vitreous humor, that is gelatinous, and the flow of fluid inside the vitreous humerus is very slow. And this aqueous humor is continuously produced and it is reabsorbed. It is in circulation actively and it maintains the intraocular pressure, and also it maintains one of the refractory media. It gives the shape of the eyeball. If we go to the ciliary body, we'll go from the ciliary body. We have some prolongation like this. These are the ciliary processes lined with the epithelium that actively secretes the aqueous humor. And this is the vascular layer containing a lot of capillaries. This is the ciliary muscle layer. Amino acid, ascorbic acid, that is vitamin C, and glucose are transported across the epithelium by active transport or by facilitated diffusion. Okay. The aqueous humor maintains the shape and intraocular pressure, and it is continually being formed and reabsorbed. Okay, so it is produced by the ciliary process of the ciliary body in the posterior chamber of the eye. Then how it is circulated? It passes over the lens and enters the anterior chamber through the pupil. Pupil is the central gap in the iris. Then it passes to the junction between the cornea and the iris, passes through the trabeculae to the canal of Selin, aqueous vein to the scleral vein. So it is from the posterior chamber, go through the pupil, going to the junction between the iris and the cornea. Okay, and here we have trabeculae. They are lined by endothelial cells. Also canal of Selin, that is also lined by endothelial cell. Then we have the small aqueous vein. Then we have the scleral vein. So ideally it is produced here in ciliary body, goes to the pupil, and it is reabsorbed at this junction, going for the trabeculae, then to the canal of Selim, then to the aqueous vein. They are called aqueous vein, although they are lined by endothelium, they are blood vessel, they are vein, but they contain the aqueous humor, the fluid. That's why these are called aqueous veins. And the canal of Selim is also lined by endothelial cell, and trabeculae lined by endothelial cell, and they have the capacity to phagocytose some of the debris passes through that, and they also are very porous. They actually gives entry to the protein. Even the RBC may come out through the trabeculae to the canal of Selim. The average normal intraocular pressure is 12 to 15 millimeter of mercury. Intraocular pressure is measured by tonometer. But where tonometer is not available, a lot of general ophthalmologists, they can assess the intraocular pressure by palpation over the eyelid. If it is glaucoma, it will be hard on palpation, like marble sometimes in acute glaucoma. But best way to assess the intraocular pressure by tonometer. Blockage of aqueous humor causes increased intraocular pressure, and we call it glaucoma. Two types of glaucoma: wide angle glaucoma, which is very common, around 90%, and why in wide angle glaucoma there is glaucoma, it is not explained properly. But we have another type of glaucoma, around 10%, narrow angle glaucoma. The angle between the iris and the cornea is decreased there. Glaucoma is the most common cause of blindness. Glaucoma is treated by medication which will decrease the secretion from the ciliary body, which will increase the flow of the CSF through the trabeculae, and they can overcome the debris in the trabeculae as well as in the canal of Selim. If the medication fail, then the ophthalmologist do the surgery. Complication due to glaucoma is very much clear cut like this. Due to increased intraocular pressure, there will be pressure on the optic disc area, pressure to the blood vessels supplying the retina, so there will be retinal damage eventually due to back pressure. So let us summarize. Formed in the ciliary process from the epithelial cell actively. We have also some ascorbic acid, citric acid, glucose. These are also transported across the epithelial cell by either facilitated diffusion or active transportation. Okay. So from the posterior chamber, the ciliary process, it goes over the lens, goes to the pupil. Pupil is the gap in the iris, and go to the trabeculae, to the canal of Selim, then ultimately opening into the veins of the sclera. And this is the glaucoma is the number one cause of blindness. And that's all about the clinical anatomy and the relationship to that of glaucoma, clinical anatomy of aqueous humor and glaucoma. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a nice day. Bye now.